Welcome to Frame by Frame, Rethink Imaging, a podcast by Radiologist. Here, we explore the intricate world of medical imaging, aiming to dissect the field and inspire both professionals and curious minds alike. I'm your host, Chris St. John. Today, totally a different day. On Frame by Frame, Rethink Imaging, we are continuing our conversation with Dr. Elizabeth Krupinski, a pioneering expert in the psychology of medical imaging. In the second part of our discussion, we will dive into the important issue of radiologist burnout and its psychological underpinnings. As a researcher focused on human factors, medical decision-making, and performance, Dr. Krupinski has a deep understanding of how cognitive load and stress impact radiologists' ability to perform at their best. In this segment, Dr. Krupinski will share her insights in what we can do to reduce burnout, improve radiologist health, and ultimately create a more supportive work environment to enhance both individual performance and patient care. Welcome back, Dr. Krupinski.
Thank you.
And so we've been talking high scale about mistakes on a psychological level, but to really start to dig into burnout, it is a significant issue in many healthcare professions, including radiology. But from a psychological perspective, what are the main factors that are just contributing to burnout in radiologists?
I think it's a matter of just the volume of images, and that is one within a given case. So, for example, CT and MRI have evolved from 16 slices to a cajillion slices, to be perfectly honest. And to get through a single MRI or CT can sometimes take, depending on the person, the complications in the patients, the number of things to find, the history, 45 minutes to an hour to get through one case. And then you've got 10 more that you've got to get through that day. And it's wow, that's a lot of images to get through and cases. Or if you're on, say, chest mammography, okay, it's not CT, it's not MRI, but now I've got hundreds of cases to get through. And, compounded, where are all these images coming from? Well, we're having an increasingly aging population. Imaging is the first line. Let's find out what's going on. Get an image. So there's a lot of images, both on the outpatient side, on the inpatient side, and it's not decreasing. And it is one of the main things, I think, is just the sheer volume. And to some extent, it's don't look a gift horse in the mouth, but we've created all this great technology that's more sophisticated, that can hopefully find more things. And so, all right, well, let's do it. And so now we're using all these imaging technologies. We're sending all these images and expecting the world from our radiologists. So to some extent, we've created the problem that we're in right now because of the advances in technology and what it can do. But it doesn't make the lesions just pop right out at you. You still got to search. You've still got to find them. You've still got to make decisions that are best for the patient. You've still got to classify the lesions and everything else. And so literally it's the volume as well as the nature of the decisions that are being rendered. The radiologist task has changed over the years from just pure diagnostic, find the lesion, tell me what it is and where it is, and okay, the other providers will do the rest, to a much more prognostic and theranostic type of decision-making process. And that is changing the cognitive load as well.
It's like being at work for me, right? So I can send an email, I can have a phone call, I can text, I can send a Slack, I can have a Zoom call, and then all this, yes, I have all of these lovely technologies that are slightly more specifically for slightly different things. But then at the end of the day, I need to tell my coworker, hey, I sent you this document. It's oh, where do I send that? And I have to go through all of these things, and all of a sudden all this very helpful technology is not really making me my most efficient self. And so what aspects of cognitive load need to be balanced to prevent burnout while maintaining a high diagnostic accuracy?
That's an interesting question, and I'm not sure you can really kind of measure that and say, okay, keep cognitive load under 50% and you're going to be fine. It would be nice if we could. That would solve a lot of the problems in the world. And I think it's not just it's a multifactorial problem. It's not just the volume of images. It's not just how complicated these cases are and so on. It's also, sort of the expectations of the healthcare system. When do the other providers, what turnaround times do they expect? What are the consequences of missing things or overcalling? What are so many other issues that go into burnout and so on? And I think to some extent, you can't just blame it on cognitive load. I mean, that's there, but, people can deal with cognitive load. There's so many ways to deal with that and adjust your schedules. I think to some extent, we as a society have to figure out what are acceptable turnaround times, for example. How many cases can one expect a radiologist to read in an hour? And of what type of exam? Is it acceptable to say 2 MRIs in an hour? Is that acceptable cognitive load and number of images? Or is it 5? And I think that, we don't want to set mandates and limits and things like that. Right. I really don't think we want the...
Well, it's counterproductive, right? Because all of a sudden, if I was supposed to look at 2 MRIs in an hour and then I've been thinking about football for 25 minutes, like...
No, exactly. I don't think we want anybody regulating, but, to some extent, there's got to be an awareness of what's going on. And I don't think that the other providers or the healthcare systems truly understand what radiologists do, to be perfectly honest, and the complicated tasks that radiologists do and what their regular workday looks like. It has been that way for years. A lot of other specialties in healthcare, the CEOs and stuff, it's just a service. Unfortunately, they treat it that way, and it shouldn't be. And I think that's to some extent where we have to make some of the changes around the expectations. And once we start to change that and get people to recognize what some of these problems are and what the radiologists are facing, that's going to change the culture. And I think that has to change more than anything else.
Yeah, all we have to do is just a real quick cultural and societal shift, which normally pretty quick turnaround on those, I've heard.
Yeah, but when it comes down, and also, just it's healthcare in general. There's huge healthcare provider shortages in the United States, around the world. And I think we have to really fundamentally change how we get providers and the types of providers and what they can do. We're very much MD focused, but there are other providers that could potentially do things. The role of APPs is increasing in radiology in many ways, in healthcare in general. But we need to rely on our nurses, our APPs, our MDs. We have the whole spectrum of healthcare providers, and perhaps figure out different ways of doing some of the tasks that have to be done, and bringing in different levels and types of expertise to either help with triage or help with the volume or help with some of the annoying tasks that a radiologist shouldn't have to do. Have somebody else deal with the interruptions. Have somebody else deal with questions from the technologists about quality or exam types or protocols or something. It's something that's going to take time, but I think that it's something that's going to be critically important if we're going to maintain the levels of healthcare that we're going to provide to our patients over the years. It's got to change.
I used to experience decision fatigue running a restaurant and throwing weddings. There would be some Saturday nights where I was just someone asked me a question about what to do, and I'm like, do something, please, just do something. I don't know anymore.
Exactly. You can't even process the question. I mean, and literally, it's not, and people may think, oh, you're just kidding, if you just thought about it, but you literally can't even get past that point. It's I can't deal with it. And that's unfortunately what true burnout is really about. I mean, it's not, oh, I'm tired or I'm fatigued. Burnout is a very different phenomena. It's actually being looked at by psychologists and by psychiatrists as something that truly is beyond just being tired, just being fatigued or being frustrated or something, that it's a chronic condition and it's something that really requires attention. You can't just pick yourself up from burnout. Fatigue, okay, go take a nap, maybe, take some time off and, you can get refreshed. Burnout it's a step beyond that, and it's really a true phenomena. And if we're creating a cohort of physicians that are experiencing burnout, just look at the suicide rates in the healthcare profession. And a lot of that increasingly is due to burnout and to a lot of the other factors that are affecting the healthcare system in general.
Yeah, absolutely. I mean, I truly believe I experienced like real, true burnout a few years ago when I actually decided to upend my entire career and stop because I was burnt out. It's not particularly sustainable to just be like, oh, your lifelong career and you've burned out. Why don't you just drop everything and walk away forever? Like, especially in this field where it's like, yeah, we need these bodies. We need these people. How do we take care of them in a way that we can start to prevent this before it happens?
Exactly. And there are efforts that are going into that. But again, it's a cultural shift.
This is going to seem like an entirely obvious question probably, but like from a psychological standpoint, how is burnout impacting a radiologist's ability to interpret images effectively?
Yeah, I mean, I think it does. I think what it could lead to is, uncertainty. You're so burnt out and that there's so much volume and that you just, like you said, you become paralyzed. And, you don't want to become paralyzed when you're rendering these types of decisions. And I think to some extent that's potentially what burnout can do. I think it takes the cognitive load, we talked about that last time. Cognitive load is probably the same. But when you're at the point of burnout, the load is the same, but the way you deal with that load is just absolutely changed dramatically, and you can't deal with that load. And you potentially there's two ways to react, well, probably three ways. There's multiple ways, I guess. One way to react is, okay, I'm going to slow down. Okay, I'm going to concentrate. I'm going to do this. Okay, but then the pressures build because you've got somebody saying, you can't slow down. You've got to keep reading images. Okay, I'll read faster. Okay, let me read faster. Let me get through these. Okay, but if I read faster, maybe I'm going to make more mistakes. I can't read more mistakes. I'm going to get in trouble. I'm going to get sued. That's not an alternative either. I mean, everybody kind of has their optimal speed, and it's going to differ for everybody. Figuring all that out, it's very difficult.
Yeah, absolutely. I mean, and like the domino effect leading to the patient, honestly, kind of terrifying to some degree, if I'm going to be totally transparent about it, right? Like the downstream effects on patient care of a radiologist experiencing burnout and just like the whisper down the lane of things that may or may not get missed until you end up at the patient is, I'm sure most people would not sit with that particularly well.
No, I mean, you don't want a pilot who's burnt out either. Think about it. I mean, there's every profession. You said, you're in the restaurant business. I was in the restaurant business. Yeah, I mean, you experience burnout and it affects all sorts of things. And everybody in every profession can experience it. Teachers experience it all the time. Social workers, special ed, everybody in the healthcare profession. I'm sure at some point in time has flirted with, is this burnout or am I just tired? Or, should I just retire and just give it up? But when, people are thinking you go through medical school, you go through residency, you go through fellowship, and, you've been in practice, say, for 5 years and you're experiencing burnout and you're thinking of retiring. It's like, wait a minute. You haven't even been practicing for as long as you were training. There is something fundamentally wrong with this. And, I think we've got to, like I said, we've got to, one, be able to recognize it and acknowledge that it exists, and then say, okay, what are the warning signs? So let's not wait till somebody's burnt out. What are the warning signs? And maybe we need more study on this and figure out exactly, what some of these warning signs are earlier. But there's tools out there that we're using. There's the Maslach Burnout Survey, and a lot of departments are using that and finding, giving it periodically to their radiologists and residents. It's finding out, is somebody at risk? There's these well-being indices that people are using. And so there are ways to assess and try to predict, okay, this person last month, they were fine. This month, wait a minute, there's some little orange or yellow signals here. Maybe we should, do something.
I haven't heard about these burnout. Are they surveys? Are they tests? Like, how do they work?
A lot of them are surveys, and they've been validated by psychologists who are doing this. And they're not just for radiologists. I mean, some are specific for healthcare or specifically tuned towards healthcare. And a lot of recognition came out during COVID. To be perfectly honest, that healthcare providers, experience burnout. And we've known it for years, even before that. But I think it brought to the general public that knowledge. But no, these are validated surveys, and you go through and you answer a series of questions that, like I said, have been carefully designed and validated that can assess, whether somebody is, kind of going down or exhibiting signs of burnout. Now, it all depends on what you then do with these. So that's where the tricky part comes in to some extent. So, it's all well and fine to do the surveys and do it anonymously and then feed that back to whoever took it and the survey to get an email saying, oh, by the way, you look like, you're a little more stressed than last month. You might want to consider blah, blah, blah. And then it comes back on the person to do something. Do we make these available to division directors, to department chairs, to HR? That's where you get into, funnier issues and things that are a little more harder to navigate. Should we make these available? I think pilots go through and they do specific batteries. And I think they go through before they go on flights or periodically, they have to take certain types of, these surveys and tests. Not for burnout, but for alcohol abuse and all sorts of stuff. And, are you ready to take this flight really? Okay, should we do that with radiologists and other physicians before, at the beginning of the day? Are you ready to be, flying in the radiology room today? Maybe not. And, but that's, again, something that, we as a society have to figure out where we want to go with all this. And, at what level do we monitor and intervene?
Absolutely. I mean, my grandmother just lost her license after taking a test to see if she was still okay to drive, and she failed.
Miserably.
I love her to death. Miserably. She's mid-90s. She shouldn't have been driving for probably a little while. I hope she doesn't listen to this meeting. I love you. But immediately her response after taking the test is, oh, well, I shouldn't have taken that test if I had known I was going to lose my license. In the industry where everyone is so short-staffed and there's already not enough bodies and images are piling up, and someone tells you, hey, you're probably pretty burnt out, why don't you just let your team get further burnt out while you try and fix? There is no good solution.
Exactly. And it kind of goes back what I was talking about before, which is the pipeline. I mean, maybe we need to rethink how many medical schools we have and how many students we admit to medical school. Maybe we need to increase that dramatically. Maybe we need to redefine some of the roles of different healthcare providers to be able to take over some of the duties of the different providers. And I think there's ways to address it, but it really is so ingrained in our society, every society, about what's expected of healthcare providers that it's going to take hopefully not a long time, but it's going to take time to change.
Yeah. I'm curious, and if you don't have an answer to this, it's totally fine, but I'm curious, what are some of the warning signs that a radiologist should be looking for within themselves, and are there strategies that they can use to, mitigate it as they realize that they're starting to burn themselves out?
Yeah, I think, some of the signs of burnout, as opposed to just general fatigue and so on, because we all get fatigued. Fatigue kind of goes away. At the end of the day, you're fatigued, you go home, have a nice hot dinner and go straight to bed. By the next morning, things are better, you have a better outlook. Some of the signs of burnout, however, are increased irritability, increased inability to deal with frustration, to deal with interruptions, just to deal with things, the high anxiety, the feeling that you're way behind, you're never going to catch up. Those feelings that are, the above and beyond, again, just kind of feeling tired, where it really starts to be pervasive. And when you leave at night, it doesn't go away.
Right.
Or the thoughts continue to haunt you. You're up at night worrying that the work list that you're going to face in the morning is going to be huge. And you're terrified to go into work. Like I said, at that level beyond.
Yeah.
And, and those are some of the warning signs. Once it gets to that on a continuous basis, then you're probably going to potentially need psychological help. But once you start to experience, some of these and you realize that it's not just, fatigue, that this is really starting to dominate your life and you're starting to see these increasing, that's the point in time where you have to then, potentially go and talk to your division director.
Right.
And say, look, this is getting too much. Not that I want to slack off, not that I want to give work to others, but I can't deal with this. Can we figure out, potentially 4 days on, 1 day off? So, different ways of scheduling and potentially reducing the workload for a bit. Mm-hmm. Whether it's division director, your department chair, or whoever, that's sort of the first way to start to deal with it is let's figure out a way to adjust what's going on. Once it gets to that extreme point, like I said, that's where potentially getting psychological help. But that's where a lot of people just say, forget it. I need to take FMLA. I got to figure out a different way of doing this. Or some people actually just leave radiology. You obviously don't want to go that far. You want to catch some of the early signs. And, the two most common ones I would say are probably anxiety and irritability.
I remember when I was truly burnt out, like everything that I used to do to like recharge from my fatigue stopped working. Like that to me was like the really big wake up call when I was like, wow, I can sit at home all day on a Sunday and do all of these self-care activities and get a massage and a haircut, which makes me feel good. And I am no better off than when I stopped working. Like,
exactly. And that's kind of the problem that, radiologists are facing, because everybody is acknowledging the fact that, yes, it's a severe problem, that people are fatigued, people are getting to the point of burnout and so on. And people are trying to figure out ways to deal with it. Now, like I said, there's these well-being indices, there's these burnout surveys. People are looking at, let's do yoga, let's take an hour off, let's off for lunch. Well, to some extent, those are good things. But if going and taking an hour off for lunch, as opposed to, grabbing the bag of chips and eating it while you're reading, leads to more anxiety because you're taking that hour off, it's counterproductive.
absolutely.
Yeah. And so, it's a significant challenge, because you can sit there and say, okay, yeah, just stop, go take a nap. But these are great suggestions, but not always feasible.
Absolutely. And like the catch-22 of like living in a culture of productivity, I'm going to use some air quotes there, where like you've been conditioned your entire life to feel guilty for taking time for yourself, for not feeling productive. Like, yeah, it's this horrid little loop that you're going to get stuck in.
Right. Yeah. Like I said, until we face this at a much broader level, the tools are there. We know what to do. There's ways. People have studied burnout for years in the field of psychology. They know the signs, they know the symptoms, they know ways to treat it and prevent it and so on. But in the practical real world, it just doesn't always work.
And so looking to the future, what changes would you recommend to ensure that they are better prepared to cope with the psychological challenges of this profession?
Boy, that's a good question. They know in advance. Because they experience and they see what the field is about. So, a lot are going in with eyes open, but that's healthcare in general. There's other, specialties that are far more susceptible to burnout than radiology, but they all really are. I think it's a matter of kind of acknowledging, one, that it exists. You can't pretend that it doesn't, but providing them with the tools. For example, AI is clearly at some point in time going to help with this, I think. We're not there yet, nowhere near. Unfortunately, I think it's probably a good 10, 15 years down the road before we truly see the full potential of what AI can do for efficiency and efficacy, and not just in little isolated pockets. And so I think it's, and it's funny. So we know what the tools are. They're out there. I think it's a matter of getting them into the workflow, getting people to recognize what the symptoms of burnout and fatigue are. But a lot of the younger generation radiologists coming in now are already aware of this stuff and, saying my well-being matters. Whereas, older generations were like, you plug through. You go to her 7, you leave at 7, and if you're tired, who cares? You just plug through it. You got to get you got to accomplish these cases. They're there. Where new generation coming in is saying, no, wait a minute. There is such a thing as work-life balance, and they're still kind of exploring what that means.
Yeah.
But they are insisting upon it. And they are saying, that it is important, that their psychological well-being is just as important as what they do at work. And if they don't have that sense of psychological, emotional, mental, physical well-being, it will impact their work. And that's the acknowledgement. And that's sort of this generation coming up now, and the ones that are coming up after them they're the ones that are going to, lead to changes, because they're not going to put up with it. And so to some extent, I could say, well, okay, you're not going to put up with it, but now you got to figure out what the solutions are. And to some extent, that's where it's going to end up, is because they're the generation that's going to be coming in that are going to have these tools, that are going to, have a sense of what they want and how they want it. And they may be the best ones to figure out how to make it happen.
Absolutely. Okay. And so with that, that brings us to the end of our episode. Once again, Dr. Elizabeth Krupinski is a professor and vice chair for research in the Department of Radiology and Imaging Sciences at Emory University School of Medicine. Dr. Krupinski, thank you so much for joining us today. And I can't wait to chat with you again sometime. Thank you so much.
Thank you for the opportunity.
Absolutely. You have a wonderful day.
You too.
Frame by Frame Rethink Imaging is brought to you by Emory. Here, you'll find engaging interviews with thought leaders, experts, and patients, sharing stories that showcase the transformative power of medical imaging. To discover how Emory is rethinking imaging in healthcare, visit Emory.com. Be sure to subscribe to Frame by Frame Rethink Imaging on Apple Podcasts, Spotify, or wherever you listen. And from all of us here at Emory, thanks for tuning in.